Have you been diagnosed with osteoporosis and are fearful that you're going to fall and break a bone?
Are you concerned about the debilitating effects that osteoporosis might have on you as you age?
Are you concerned there's so much contradictory information out there on nutrition, exercise, and medications?
If you answered yes to any of these questions, you should join us at the VTFC Bone Health Program.
Hi, I'm Susan.
And I'm Carrie.
Our bone health program is a truly unique, integrative approach to not only building strong bones, but a strong, healthy body as well.
This program is aimed to reduce the risk of fractures and to regain confidence in your body so that you can continue to live a healthy and active lifestyle.
Carrie and I have combined our expertise, her expertise in therapeutic exercise and my expertise in nutrition and integrative health. I will go through your diet. I'm going to put you on a nutrition program that's going to provide all the nutrients that you need to build strong, healthy bones.
And I'll run you through an exercise program that's geared to build your strength and your balance so that you can live life without the fear of a fall.
So if you're afraid of being fragile and walking around, possibly tripping and falling and breaking a bone, come see us.
Building strong bones and a healthy body will help keep you living an active, vibrant, healthy lifestyle at any age. Most people think of exercise as something that is only for athletes, but it's really important that we think of ourselves as an athlete no matter how old we are, no matter who we are, because if you're moving and picking things up off the ground, those are athletic movements that we need to maintain through our life. And when we start shortening up what we're able to do in our day, it becomes debilitating. And it's really important that you think about yourself as an athlete and you train yourself like an athlete. You just have to keep it at a level that you can sustain.
Well, and I want to add, one thing that has been positively associated with better bone quality is lean muscle mass. And what we know is the more lean muscle mass you have, the stronger your bones are going to be. And lean muscle mass is absolutely, created by doing the appropriate exercises, but you also have to have the appropriate nutrients. To be able to build muscle, you need adequate protein, and you need other nutrients that help you to build the muscle that the exercises are promoting. And the other important thing about the exercise is for our bones to get stronger, not only do we need impact exercises, which create a force through the bone, and it's this force that causes the bone to turn over and get stronger. We need resistive exercises as well. When the muscle contracts while you're lifting a weight or pulling on a resistive band, that muscle produces a hormone called irisin. And irisin talks directly to the bone and tells the bone to turn over and get stronger. So again, really important that not only are you getting the nutrition you need to build strong bones, but the appropriate exercise as well. Bone health begins as we are adolescents, because it's at that period in our life where we are producing the most bone that we are ever going to have. And we produce bone to what we call our peak bone mass. And that's the greatest amount of bone that you're ever going to have. And we reach that peak bone mass around 24, 25 in women, around 28 in men. And our adolescents, particularly girls who may be anorexic, not getting enough exercise, sleep, stress, they're not going to produce as much bone as they should be. And I look at this as a bone bank. So during our adolescent years, we want to put as much bone in that bone bank as we can possibly get. Because later in life, it's going to be inevitable that when you go through menopause, you're going to get a decline in bone. But the more bone you have in that bone bank, a slight decline in the bone, you're still going to be okay. But if you haven't built up that bone, you haven't deposited enough bone in that bone bank, when you start to lose bone going through menopause, it's going to take you right into osteoporosis. So, the nutrients, the exercise, all of that is critical to building bone as an adolescent.
And I know it can seem like people, if I haven't had enough bone by 25, what's the point in starting now? It's really important to realize that you will continue to lose bone mass. That is something that we cannot take away, but you can slow down how quickly you're going into that bone mass and how quickly that bone mass is becoming weaker. And so we want to make sure that you're seeing that it's never too late to start building your bone strength and building your body's ability to gain strength in its muscles and to preserve whatever amount of bone you have left. Don't ever think that it's too late because you've heard that number that if I didn't get it by 25, I'm not going to get it. There's never a too late of a place to start.
But there's also a difference between bone density and bone quality. Okay, so density is usually determined by a DEXA scan, and we have no real way of determining bone quality. So this is a great example. I've had patients who have had osteoporosis or pretty significant osteoporosis, but they have been exercising, they have a good quality diet, they do stress management techniques, and they've fallen and they haven't sustained a fracture. And yet I've had other patients who have low bone mass or osteopenia, which is seen as the precursor to osteoporosis. They have a poor diet, they drink alcohol, they don't exercise, they sit behind a desk all day, they're very stressed. One slip and fall and they break a bone. So the difference between those two people is the quality of bone that they have. So as Carrie said, maybe you didn't put a lot of bone in your bone bank and you are going to have, bone density issues later in life. By eating well, exercising, stress management, making sure you have a healthy digestive system, and taking appropriate supplements, you can maintain bone quality and prevent the fractures.
Motivating people is something that I love doing. It's part of who I am. And I think that people come to us and they're broken and they feel weak and they feel like they're in pain. And what we want to do is show them there is a light at the end of the tunnel and that there's hope so that you can build your balance. People come all the time and say, I'm horrible at balance. I can't stand on one leg. I'm like, well, let's fix that. If someone gives you hope, if someone says, I can make that better, and they actually start to show you that you can make those improvements, that's motivational. I don't know any person that I've ever worked with that doesn't come see some positive rewards and then says, I didn't like that. Now, they're busy and they may have issues trying to get in here as much as they'd like, but they always see that it's the strive to continue to get better is what is the motivational factor. Your family, the people that you want to survive and thrive around, they depend on you. And so by me reminding my patients and my clients what they're doing this for, you want to get down onto the ground with your grandchildren. You want to be able to walk your daughter down the aisle. You want to walk your granddaughter down the aisle. You want to be there and be part of your family's lives. And so my job is very easy to motivate people because I can help you move better. I can see what are your issues that you're moving poorly through and then change them so that you have confidence that you can do it on your own and you can continue to build that so that every year you get stronger. How many people promise you that?
I also think, motivation, when people come to us, they haven't been eating a great diet, maybe very high processed foods, sugars, can actually make you feel not great, can cause depression. It doesn't give you a lot of energy. So when you start eating a great diet and you combine it with exercise, you start feeling energy, and that feeling of well-being motivates people to continue.
A lot of times people come to us and they see great rewards, but not everybody can get into our walls and our space to be able to be trained by us. And so what we have created is options for online. I have a website, PNX Solutions, that is based about 10-minute exercises or less. It's instructional videos and then workouts. So if you are doing a 10-minute workout and something doesn't feel right, you can then go back to the exercise and find out how to do it properly. And if you can't keep up with the workout, piecing through just how to do the exercises is the best way to slowly progress yourself to the point where you're able to then do 1, 2, 3 to maybe even 5 exercise workouts in a row. That's the beauty of what I'd like to offer, is that we're bringing something that they can do by 10 minutes if you have it, and if you have a little bit more, you can do more. But the best part is everything is done with very minimal equipment and something that you can do at home or in your neighbor's living room. We want to bring people into health and into vibrance, and that can be done on your own, but sometimes a group is really helpful. So if you can't come to us, form your own group and really motivate those around you.
Carrie and I have also put together an online osteoporosis program, and it's awesome. It's very complete and very thorough. In our online program, there's a nutrition module as well as an exercise module. So you can go through all the nutrition aspects that are important for osteoporosis, and then we compare them with Carrie's exercises as well. We provide bonuses as well, like a cookbook with a 2-week diet protocol, information on stress reduction, where to get some exercise equipment that Carrie uses in the exercise videos. So it's a very contained program that's going to walk you through everything that Carrie and I do here at Virginia Therapy and Fitness Center. Well, I think one thing, again, that's unique to this program is we've combined the exercise and nutrition. And for somebody that doesn't have access to Carrie and I, it may take a little work on your part to find a good nutritionist that understands the critical bone building nutrients that you need, as well as finding a physical therapist or a qualified trainer that can lead you through exercises in a safe way.
And trainers are everywhere, but they're not all for you. Typically in a gym, you may find people who look great and you want to be like, but when you're picking your trainer, you have to go beyond the personality and find the skill. So you can find good trainers all over the world, but it's up to you to ask the right questions and to feel how you feel when you leave the gym or you wake up the next morning. If the joints hurt that you usually feel pain with when you exercise with trainers, that's not the trainer for you. That's one of the things that every patient comes to me and says is that, oh, well, I've never done it like this before. Well, that's why you have to find a trainer who's going beyond the exercise and finding you and figuring out how you can do these exercises in the way that fits your body and your problems and your strengths. And that's what makes the programs that we instruct and we forward people to so important. When you're looking online for exercise programs, there are no shortage of them. You can find them wherever you go. But again, I will come back to say, how do you feel after you've done those exercises? If the exercises cause you pain in familiar symptomatic areas, then it's not the right place for you. You have to keep looking, keep diving in. If you want to reach out to us, we would be more than happy to help you find someone in your area. But just go beyond the bicep curls, go beyond the big bulky muscles, and find your posture, find your strength and your confidence at living.
For bones, absolutely critical that you get impact exercise, and water aerobics is really great for that arthritic joint because it's not putting the impact through that joint. But for bones, we need that impact. So water aerobics would not be my first choice for anybody that has osteoporosis. However, having said that, there's no reason why you can't combine doing water aerobics one day and walking the next day, doing resistance exercises the next day. But doing water aerobics by itself is not enough to strengthen your bones.
And one other factor that we enter in when we think about water therapy is the water's moving, so you're moving. So it's very difficult for you to figure out what is in control, what I have control of, and what's controlling me. So that is another piece of the water therapy. Yes, if you're doing nothing, then the impact that you might get from the beginning of a water therapy is better than sitting on a couch. And with osteoporosis, we like to see you progress to dry land as quickly as possible. Many people, when I talk to them in the beginning, they're so fearful of exercise, and it's taken them so long to come see me that the first thing they say once we've done our first exercise and they realize there's something different here is they say, I've never done anything like this before, it didn't hurt. How come that didn't hurt? So it's really important for you to understand that you have to start somewhere. And if the exercise that you're doing creates more pain, then stop. But never starting any exercise based off of the fear that you might fall or the fear that you might hurt yourself is only putting yourself into a hole that is much more difficult for you to climb out of. Climb out of that hole slowly but surely by finding and trying different people. You try one session with one trainer and you don't like it, go find another trainer. You could play around in your gym. You could play around in your physical therapy office. You can look on the internet to find some functional trainers that really get that you're trying to train for functions of life rather than pretty muscles and aesthetic bodies. Remember, you are not fragile unless you think you're fragile. Break out of that fragility mold and find your strength by trying something new and safe.
And I also think, when you're first starting exercise, it's really important to find a quality trainer or a physical therapist because they'll be able to guide you through the exercises safely with the correct body mechanics and posture so that you're not going to hurt yourself. I think the biggest problem is somebody that hasn't been exercising just showing up at a gym and starting to pump iron, because that is a recipe for disaster. So if you're just starting out in the exercise, look for somebody qualified to guide you through a safe, effective exercise program.
Something that I say often is that posture needs exercise. It's not just about the muscles, it's how do you hold your body while doing those exercises. It's extremely important. And one thing that a lot of people do is they go running or walking to try and get into shape. But there's also another phrase that we say a lot in our office, and is it you should never run to get in shape. You need to get in shape to run. And anyone who just starts pounding the pavement without any thought to how they're building up the strength to get there is taking a risk. And for that, we again remind you, start somewhere, but start safely. Don't just go run off to the fences.
So, you say calories in, calories out, but what you also have to realize that the more lean muscle mass that you have, the higher your metabolism is going to be. So as you exercise and you are building more lean muscle mass, your metabolism gets faster, which means that you can consume more calories without gaining weight. But yes, when we first start to exercise, we are going to be more hungry. So really important to make sure that you're eating fat, which is going to fill you up a little bit more. So healthy fats from avocados and extra virgin olive oil and nuts and seeds. Also fiber, because fiber is going to fill you up as well. So when you're starting to exercise and you're feeling hungry, you can eat more, healthy snacks during the day, and that's going to help you to not be as hungry and also to give you good quality nutrients so that you can build good quality bone and muscle.
And don't forget the importance of drinking water. It's the best way to fill yourself up a little bit, never starving yourself, but always drink, drink, drink. That'll get your stomach feeling a little bit fuller when you've just worked out and your body needs the hydration. So when I'm asked what is my favorite exercise, oftentimes I answer that's a tough question because I have a lot of favorite exercises. But if you were to ask me today, I would say that my favorite exercise is the Beast. And it is a combination of a plank and a crawling action where your knees never touch the ground. They hover just barely off the ground, and you have to learn to coordinate your movements of your arms and legs while looking like a cat praying through the grass. And so that ability to control your your proximal posture, your torso and all the muscles around your core, and the ability to then move with dexterity through your limbs is something that is athletic at any age and safe at any age, as long as done with the proper progression and the proper instruction to get you started.